In managing their finances, older adults may experience pressure from family members or other sources. This undue influence may adversely affect their decision-making. Undue influence may occur for both financial and healthcare decision-making. In this scenario, we see a mother and daughter interacting in a GP's office, although it could be any health professional's office. The question in this scene, given the undue influence, is whether it really is time.
Hi, Doctor. Hello. Hello, Doctor. Hello.
So, Mrs. Stewart, how are you today?
I'm fine, thank you, Doctor.
Mum, tell the doctor what we talked about.
What?
It's Mum's memory. She's been very forgetful and distracted lately.
Well, I've been feeling a bit low, but...
She's been doing some silly things with her money, taking out a lot of cash from the bank and misplacing it.
Not really.
She bought a holiday cruise over the phone. A cruise. It's the sort of place someone Mum's age should not be going.
Well, I've been feeling a bit depressed and I thought...
See, Doctor, as I told you, it's not safe for her. I'm worried about people taking advantage of her. You need to do an assessment of Mum.
No.
I don't know whether she should be going to a nursing home or still living with us, but she should definitely not be signing over any more cheques to the church without talking to me about it
But
first.
I've been feeling sad and giving money to the church makes me
See,
feel...
giving it away. Giving it away. Have you ever? You realise I'm only worried for Mum's sake.
No.
Mum, I think it's time that you let me manage your money for you. Yes,
no.
now is the time. I'm sure the doctor sees the sense in this.
The time? Yes, it does seem like the right time, yes.
Jared, in this scene, in the GP's office with this mother and daughter, what struck you the most?
I think the thing that struck me the most was the risk of undue influence occurring. It looked to me as if the older lady was being perhaps browbeaten by her daughter and perhaps being pushed into a situation where she might have to do something that she really wasn't all that keen to do.
Could undue influence come from other quarters besides the person's family?
Undue influence can come from many different quarters. It can, of course, come from close family or friends, but it may come from professional advisors, including legal and health workers. It may come from paid or unpaid carers. It could come from all sorts of sources, and I think the doctor, when they're doing their assessment, needs to be alert to these possibilities.
What should the next course of action be for this doctor?
Well, I think the doctor needs to schedule a much longer consultation, and a consultation in which she can interview the older lady by herself at some length. She may also need to interview other people, including the old lady's daughter, but other collateral sources of information may also need to be sought. I guess it really depends on whether the doctor finds the older lady to have impaired capacity for financial decision making or not, or if it seems a bit grey, not sure whether she does have impaired capacity or not. I think in the situation where it's uncertain, it'll require more effort.
In a longer consultation with this older woman, what are the key points the GP would want to cover?
Well, I think in a longer consultation, it's important for the doctor to do a good cognitive assessment of the older person by themselves without anyone else present. Then the doctor needs to ask the older lady about her assets, because we are talking about the management of her financial assets. So in order to manage them, the older lady needs to know what her asset classes are and what assets she has in each class, at least roughly. These days, of course, many people with substantial assets obtain help. They might get help from an accountant or a financial planner, and so it's quite okay for a person to obtain help. That doesn't invalidate their capacity to manage their finances. In fact, it probably shows good common sense on their part. However, they need to be able to provide advice to the people managing their assets about how they would like those assets managed. So the doctor needs to assess that. And of course, it's important for the doctor also to assess some mental health issues that might be relevant to financial capacity. First of all, is the person depressed? Because if they're depressed, they might have a negative view about the quantity of their assets or the disposition of their assets. They might have psychotic symptoms if they have a psychotic disorder, and for instance they might have a delusion that someone is out to get their money when that's not the case. So those things could have an important influence on a person's financial capacity. Of course they're potentially treatable, so they may be reversible. And finally, I think the doctor needs to assess the quality of the interpersonal relationships that the older person has, both within their family and outside. Quite often an older person will believe that they're on good terms with certain family members who've been very helpful, but it often turns out that those helpful family members are actually keeping a close eye on the older person's assets with a view to gaining a greater share of them than they deserve. So I think the doctor has to take a very broad perspective on the assessment of the older person when considering their financial capacity.
Is a GP well placed to comment on these issues?
I think that the GP, particularly if they've known the person for a long time, is in a very good position to make a judgment about the impact of health issues on the person's likely capacity. So yeah, I think the GP is in a good position generally. They need to use the information that they have, that they've obtained over a number of years of contact with the patient, to inform their judgment. It's not simply a matter of looking at the cross-sectional performance. There's a context, particularly a health context, which needs to be taken into account. There could be intercurrent factors, in this case particularly depression. If the old lady does have depression, that may need to be treated because her capacity might improve if the depression was treated.
So in other words, capacity isn't necessarily static.
It's not static at all. It's quite dynamic. It's affected by the general health of the person. It's also affected by contextual factors, including the decisions, the complexity of the decisions which the person is required to make. So one might have capacity for simple decisions, but not capacity for complex decisions.
Is this an easy situation?
I don't think the assessment of financial capacity and the potential influence or undue influence that might be going on here, particularly in the possible presence of depression, I don't think this is an easy case at all. I think the doctor has every right to be cautious and to take their time and to allocate sufficient time in order to do a good job at this. And if they're not sure after all of that, they should refer the patient on to someone who might be in a better position to do it.
Given what we saw, this woman saying she likes to make donations, that she wants to go on a cruise, does that really indicate that she's lost capacity?
It's difficult to say, isn't it? I mean, it may be that these decisions are the sorts of decisions that the older lady often made previously and simply reflect her pre-morbid function, her normal function. Alternatively, they may reflect poor judgment due to cognitive impairment or due to an attempt to self-treat a depressive illness. It's hard to know. We don't have sufficient information to make that judgment, and so we need to be cautious about prematurely closing on one particular interpretation of what's going on.
What are the potential downsides if this process proceeds too quickly?
It's quite easy to make a mistake. This older lady might be in a situation where her capacity to make decisions improves with the treatment of her depression, if she has depression, or with the treatment of her cognitive impairment, as she seems to have. Perhaps she needs drug treatment for Alzheimer's disease or the like that might take her from a position of not having financial capacity to a position where she does have financial capacity. So making a recommendation about capacity without a thorough assessment of the situation could disadvantage the patient.
If this is the first time the GP is seeing this patient, would they have enough information?
I think if the doctor has not seen this older lady before, then they need to be much more cautious in their approach to making a decision about likely financial capacity, because it could be that the patient's daughter has been taking her around from one doctor to another in order to find an opinion which suits her situation.
Do you have any final thoughts on this scenario?
Well, I think overall this is a complex situation. It's a common situation, particularly in the ageing population that we're faced with, but it's a complex situation, and health workers, doctors and other workers need to take care in their judgments and not jump to conclusions and not be unduly influenced by parties who may have something to gain from the transaction.
Jared, thank you so much for your time today.
My pleasure.